Thanks so much for joining us. I'm Laura Lovett. I'm the managing editor at Buoy Health News, and we're joined by Buoy Health co-founder and CEO, Dr. Andrew Lee. Thanks so much for joining us.
Of course. Thanks for having me, Laura.
Great. So I'd love to start off. You were one of the early adopters to sort of start creating tools for the coronavirus. Could you talk a little bit about how that sort of morphed and evolved and what the tool looks like today?
What was happening in January, we were really tracking coronavirus as it was spreading through China and seeing how much it was affecting that country. And we just expected that the same thing would happen in the United States when it comes over. And so our team, over the course of 11 days, sprinted to build the CDC guidelines and incorporate them into our AI in a very natural way, such that if someone came in with coronavirus-like symptoms or told us explicitly that they were worried about coronavirus, we would use the CDC guidelines to screen them and put them into different buckets of risk, either low, kind of medium, or high, and having corresponding actions, again, driven by those guidelines about what to do next. We released those guidelines back on February 5th. At the time, there were only a handful of cases in the United States. And then because we have these millions of users using Buoy all the time, what we saw over the course of the month of February was that we were seeing pockets of high risk in very specific geographies, days to weeks before a confirmed case would show up in that area. It was astounding. It would happen, the first time we saw it was in Washington State. And, we were thinking maybe this is an anomaly, but then it just kept repeating itself. Florida, Tennessee, Alabama, Arizona. It's happened across 12 or 14 different states where we were seeing the hotspot, again, right before it would occur. Right around that same time, and I'll just kind of frame this as the CDC guidelines screening you for coronavirus were built into our natural flow. So you really wouldn't know if you were being screened unless you screened positive. And what we discovered during this early phase was that for those who are deemed to be low risk for coronavirus and explicitly said that they were worried about coronavirus, actually showing them what could be going on besides coronavirus was very helpful to them for allaying their fear and keeping them from running into the doctor or calling the doctor or calling the nurse. So as companies, we were basically approached by numerous groups who were looking to better manage COVID as more and more of their population were affected, but also the fear was spreading in their population. And we built a more specific COVID flow that explicitly used the screening tool up front. And then with a partner, they could then hand off their member or patient to the exact services that are appropriate for them, given their given their membership. Yeah. And that evolution really showed that, again, for those who are in the low risk bucket, if you could give them a sense for what else might be going on, you can get them to self-isolate, which is important, but in addition, kind of keep them from picking up that phone and immediately calling someone, which we find that actually 75% of the time people don't need to call in, and 90% of the time they don't need to go to an in-person visit, which during this really trying time is important because the supply of healthcare, whether you consider that to be telemedicine or nurse lines or urgent cares, emergency rooms, beds, ventilators, are being taxed to the limit. There being a 3-hour wait time for number of different telemedicine companies right now. We really see having Buoy in the front here as essentially this traffic cop that's empowering people to make really good decisions means that the right people are seeking care at the right time, which is a life and death problem to be solved during COVID.
And then, one of the things I think is really interesting, I know we talked about it when I was at the Buoy Health office about a month ago, but was kind of reaching people in their homes and getting information, right? There's a lack of testing right now, so we don't really know how many people are being tested or how many people have it. So I'm interested in kind of hearing from you a little bit about, what information you're finding out from, getting these sort of in-home triage system. What does that look like?
From a data perspective, we expected that the usage patterns of Buoy from a time perspective would translate over during COVID times. And when I say time perspectives, what I'm really alluding to is like how long people have been sick when they actually use Buoy versus when they would potentially go to the doctor. And what we're finding is that the average person who's using Buoy has had symptoms for less than 12 hours, which is actually consistent with kind of our general non-COVID use case. And so we're finding people really early on when they're just getting symptomatic, potentially with COVID. Now, because of the lack of testing, what this means is a lot of times what we can offer them is, a consultation with the clinician, or to really actually do some self-isolation and self-monitoring, following up with these people via text if they opt into it, and really helping them track their symptoms. In part of that entire kind of tracking process that they're, that we're helping them with, as well as kind of engaging with these people really early on. As testing becomes more and more available, we can make people aware that testing is now available in their particular area. So our partnership with the state of Massachusetts, for instance, we're actually now, we're soon going to be releasing a feature that takes into account local test centers and how long the wait time is for those test centers. That's not yet live now, but that's something that we're actively working on.
Yeah, and I'd love to touch a little bit more on that partnership with the state of Massachusetts, and even, this idea of more and more public-private partnerships during this time. So could you walk me through that partnership and then a little bit what it means, reaching out between those startups and government?
The state of Massachusetts and the Department of Health and Human Services and the command center in the state have been traditionally always very progressive. And Governor Baker has been really beating the drum of the effectiveness and necessity of telemedicine during these times, especially because, you go into see a doctor physically, it increases your risk of transmitting something or catching something, as well as putting the healthcare staff at risk. And so with how progressive they've been thinking about things, they kind of got to the point where they naturally said, well, telemedicine could actually have a front engine, like a front line, a front door to even telemedicine. And being a Boston-based company, we kind of we talked about the opportunity to have Buoy leverage our AI and screening features to sit in front of telemedicine, just like we'd sit in front of testing, sit in front of emergency rooms, sit in front of in-person care, do that navigation to really identify people who should call and those who should not, those who should go in and those who should not, and really also help the state as this potentially gets worse, update guidance as well as resources that they show as the supply of healthcare potentially gets more and more taxed. So right now we're thinking a lot about, the wait time for telemedicine or the wait time to call a nurse. Unfortunately, if more and more people get sick, we're going to be thinking more about the supply of beds, the supply of ventilators. And the opportunity here is that you can continue to update how you hand people off given their clinical situation, such that the state can really help manage individual people at scale as this potentially gets worse. So, today we're talking about shifting people to or from like telemedicine, but eventually we're thinking, how do you potentially show people that this hospital is overflowing versus this one is not, and doing that load management, essentially. That was the vision that the state had, and that is exactly what we do in our day job, is load management and navigation. And now applying it to COVID, it's been a very kind of emotional experience to be able to help our home state. I think we've had, I believe, only 30 to 40,000 people use it since we launched last Friday. And it's just been, incredible just thinking about the reach and the size of our impact, given that we're a startup that's doing this.
Yeah, that kind of brings up another point too, which is, more and more people are sort of adopting digital tools, and it's a lot of people's first time that they've used telemedicine or used triage. How do you see this situation right now sort of influencing digital health and influencing the whole health community sort of, down the road?
Yeah, that's such a great question. I really find, and I guess I alluded to this just now, that COVID is essentially a microcosm of the problem that we see all the time, which is that when you get sick, you all of a sudden have to morph into your own doctor to then figure out clinically what to do next. And layered on top of that complexity is that you also have to understand your benefit design to figure out which doctor to go see. And so on a daily basis, let's take like you have back pain, for instance. You have to figure out what's going on with my back, and then you have to figure out which doctor in network is for me. And if you make a bad decision there, it could be really bad. You go to the emergency room, you get an opioid, potentially you develop a substance use disorder. That is a really bad outcome from one bad decision point that really you don't have the tools today to fulfill. That's the problem that we're solving is, one, you don't clinically know what's going on, but B, you don't know exactly where to go from a navigation perspective. With COVID, that is like intensified, by a million, right? Like this is exactly that problem, but specifically for COVID. I'm coughing, do I have COVID or not? So clinically, I don't know what's going on. But even if I did know what was going on, I have no idea whether testing is available. I don't know what doctors I should go see. I don't know which telemedicine company I should call. And so for us, we really see this as highlighting the problem that exists on a daily basis in non-COVID times and the opportunity to use digital health to empower people to make better decisions, but also just to improve the efficiency and effectiveness of healthcare overall. Better care at a lower cost is the promise. And what we're doing today is, again, just a very sharp example of that.
I'm interested too in talking a little bit about the follow-up. And so, how, obviously you're kind of at the triage stage, but, what are you looking at in terms of kind of following patients through their experience and how do you view that?
Our follow-up feature we released, I believe, end of last year. And what the opportunity is, you would kind of opt into receiving a text message from Buoy 3 days later. And the feature, very frankly, at the very beginning was really intended to understand how people ended up seeking care a couple of days later. Now, in working in conjunction with the state, we're better understanding how we could leverage the follow-up feature during these very specific COVID times. And so you can imagine that how you self-quarantine, how you self-isolate is not super obvious, especially if you live with other people, which, the majority of the population is living with their family or partners or roommates or whatever. So I think there's a really big opportunity to leverage follow-up to think about scalably helping people in their process of self-isolation and self-quarantine. The other opportunity is to think about whether things have changed clinically. So if you're having, let's say, a fever and testing is not available and your bucket of risk is really around self-isolation, it's not necessarily true that your fever is the only thing that's going to happen over the next 14, 21 days. So now actually checking in to see if things have changed or gotten worse. And thus, are you actually in a different bucket of risk? Should we actually be managing you differently? That's another big opportunity from a check-in perspective. And that's where we're headed as a company to then say, okay, we really help with that front door component. How do we lengthen the relationship to make the patient smarter over time as well, empowering them not just today, but 14 days later?